All right, welcome back. I'm here to share with you today a little bit about the future of healthcare. And hopefully we can, hopefully this is helpful to hear a little bit of perspective coming from the textbook, coming from my perspective. Hopefully you can kind of integrate this with what you've been reading and learning about so you can have an understanding of the future directions of healthcare, but also thinking about trying to contextualize that to your future and your role in healthcare. So Dr. Pinegar, a finance professional, very interesting quote. The only thing we know about the future is that our forecasts are wrong. The future is so difficult to predict. And I think it's really important that we understand our role as healthcare professionals. We understand the amount of stress on us, on the system, on our processes, on the individuals we're serving, on the importance that we do good, that we have altruistic good intentions, that we are doing, breathing, cultivating positivity in the workforce, that we're creating hope for our patients, and that we're doing meaningful work that makes their life better. But we also have to be real about the economic factors, about cost, about how cost impacts quality, about how we can only do so much with so little, and about the growing national debt and the expense that is associated with our health system. And then about value congruence, the idea that what we value, what we believe in needs to be shown in our actions, and the idea that if we say the goal of our health system is to provide great care, then that's what we need to be doing. It's not money, it's not based on revenue generation, it's based on care. And so we really have to think about that as health services administrators. Now, this is a really unique model, and this is, we're thinking about it from a workforce perspective. So imagine you're a health services administrator, right? And this is really, this is from an article that's looking at an application in nursing, but this works for us too. This is looking at job satisfaction, likelihood to leave your job, likelihood to leave the profession as a whole, how much you want to do good, how much your values align with the organization and others, value congruence, how much you need money, economic factors, and how much stress you're under. And this value, this model generates different coefficients, right, to tell us how related these factors are. And if you know anything about our values, and we won't get too specific, but that is looking at correlation, looking at relationships. So there's a strong relationship between altruism and job satisfaction, how happy you are, how much you want to do good in the world around you, and how much you like your job, right? Stress has a negative relationship to job satisfaction, is circled here. And so we have to keep that in mind. We want to be a health services administrator that works to reduce stress amongst our clinical team members and other folks we're working in. And we want to increase the likelihood that folks believe in the work that they're doing, but not so much that they get discouraged, because altruism as a whole actually leads to people becoming disenchanted, feeling like they can't be their best self or lead an organization effectively, and they leave the organization. Really interesting viewpoints. All right. And of course, economic factors are important, right? Do we pay people appropriately? All of those components. One thing that I do want to refer to really quickly here is how we have more control than we realize, right? Recruitment and retention stipends and financial incentives work wonders, but also the way that we value our staff, the way that we communicate and engage them is really important. So for your short write-up, number 3, you've been asked to talk about a nursing staff shortage issue. And I just want to reflect on that a little bit more now that we're moving into module 5. Staff shortages are everywhere. Where I live in East Tennessee, they're very prevalent. I know several individuals who work as traveling nurses, right? Data suggests that full-time primary care clinicians should have 24 rather than 32 hours of face-to-face clinical time during a typical work week, with another 20 hours of virtual and administrative functions in order to allow them to do their job well. But most clinicians work 4 or 5 days a week with very little administrative time, right? So we as administrators have to think, well, how do we allow for our clinicians to have more time to get done what they need to get done? And how do we do more with less? How do we have them see more patients, but also provide more value, provide better care in that time? Okay, so that being said, the other big piece of the future landscape is the policy landscape. President Biden's proposed healthcare plan, right? We haven't moved forward yet. I don't know that it will. A proposal to ensure 97% of Americans. And it limits the amount Americans can pay for insurance coverage to 8.5% of their income, whereas some individuals are paying 20, 25, 30% of their income in extreme circumstances. The goal is also to reduce drug prices, limit the launch prices, the initial prices, and tie any price increases in pharmaceuticals to inflation. But this begs the greater question, when, if ever, will we be able to attempt the idea of a single payer system? Now, unfortunately, that is, for lack of a better word, not a realistic solution at this point. There are a lot of individuals with power and control and opportunity, especially interest groups, and it would take a lot of change in order to bring that about. That being said, there are a lot of conversations about Medicare for All, the idea of a government open insurance plan in which individuals could participate in, could have access to. When we think about these solutions, we have to think about balancing the demand, understanding who needs services, and how expensive those services could be if individuals who haven't had health insurance are the ones who sign up, who need that care, who maybe need a little bit of reconstructive dental work maybe, or a surgery they've been putting off for 3 years. We also have to think about debt and the cost to our nation, how much providers make, if they're paid salary, if they're paid fee for service, and how payers, providers, and patients all come together to make care decisions. All of this is important when we consider policy decisions. We also have to think about technology. Much of my research has been in the telehealth space, and there's a lot of opportunity for growing the use of telehealth, but there are a lot of limitations with telehealth as well, right? If I don't have labs or labs or vital signs, right? It's hard to deliver the same quality of care and do the same type of diagnostic work. We may want to leverage additional home visits or see how we can leverage non-physician providers like nurse practitioners and physician assistants to do more work. And then have the data support improved processes through clinical decision support systems. So these are all ways that technology and that improved workflows could be involved. Two of the recent buzzwords in healthcare are personalized medicine and regenerative medicine. Personalized medicine is the idea of computer modeling related to DNA, your background, and running lab tests to provide care. Regenerative medicine, right, is around restoring. And there's a really cool YouTube article, or YouTube video you should watch. Don't let me butcher it for you. But the idea that for certain types of tissue, right, we can transplant, we can grow this tissue in order to not personalized medicine based on DNA, but based on a match, right, blood type, provide a chance for a failing body to be restored in certain ways. Now, I have a couple thoughts, and I'd like it if you could take a minute and just think and digest for a moment. I know you have some reflections that you're doing throughout the course. I want you to think and digest for a minute on what your key takeaways are here. And this is where you and I should take an opportunity to connect if you really want to think about what did not sit well with you about the health system in our course, what future changes you want to see come to fruition, we have an opportunity to make meaningful change in our health system. So I want you to really take some time during the last week or so of our course and really reflect on that. And that can help form your drive to what projects you work on in future courses, kind of developing an area of specialization or interest in our health system. As far as the exam review, our last exam, I just want to touch on this for a second. We'll have 30 questions randomly selected from a library of questions, primarily focusing on chapters 13 and 14. And there's a study guide posted at the very bottom of our course. You know, there's that separate module link below module 5 that has the exam information. The reason I say predominantly focus on chapters 13 and 14 is a lot of this knowledge has been building. So it may be a concept that's reinforced in chapter 14, but it was introduced in chapter 8. So don't want you to get discouraged if you feel like this is something you saw before or something from another chapter. There's a lot of overlap. So just keep that in mind. All right. Well, thank you so much for taking a moment to listen to this. I appreciate it.